Hello, my name's Sarita Dewan. I'm a clinical psychologist and clinical lead for the Early Attachment Service in Hayward, Middleton and Rochdale. World Patient Safety Day is observed annually on the 17th of September. Objectives of the day are to enhance global understanding of patient safety, to increase public engagement in healthcare safety, and to promote global action to prevent and reduce avoidable harm in healthcare. Each year, a new theme is selected to shed light on a priority patient safety area, where action is needed to reduce avoidable harm in healthcare and achieve universal health coverage. Considering the significant burden of harm women and newborns are exposed to due to unsafe care, this year's World Patient Safety Day is dedicated to the need to prioritise and address safety in maternal and newborn care, particularly around the time of childbirth when most harm occurs. This has been especially important in the context of the disruption of healthcare services due to the COVID-19 pandemic, which has further compounded the situation. The clinical leads for Pennine Care's Parent Infant Mental Health Services wanted to take this opportunity to raise the profile of perinatal mental health and highlight some of the red flags to look out for when working with parents during this period, particularly because we know how important that parent mental health is for infant development.
What follows are 4 red flags that should prompt emergency or urgent psychiatric assessment. If one red flag is present, please make an urgent referral to your local mental health service. All women presenting with 1 or more red flags should also be referred urgently to the perinatal community mental health team. And of course, your local parent infant mental health service and perinatal community mental health team are available for advice should you need it. Please look out for recent significant negative change in mental state or emergence of new symptoms. Any new thoughts of self-harm or suicide or any acts of self-harm. And violent thoughts of suicide are of particular concern, such as thoughts of thinking of jumping off a bridge. New or persistent thoughts of incompetency as a parent or feelings of estrangement from the infant. For example, thoughts such as, I'm a terrible mother or father, I think my children will be better off without me. Repeat referrals for mental health concerns should also be considered a red flag. It's a really exciting time at the moment for parent infant mental health and perinatal mental health. There's lots going on, particularly in Greater Manchester. Each borough within Pennine Care has its own parent infant mental health service, each in its own stage of development. You can find out more at our web pages. If you're interested in keeping up to date and hearing about new developments, there are a number of services and clinical leads that are on social media that you can follow. And finally, while the parent infant mental health services provided by Pennine Care have a focus on the infant's mental health, the relationship between the infant and their parent and carer, and of course the parent or carer's mental health, our colleagues in the specialist perinatal community mental health team provided by Greater Manchester Mental Health NHS Foundation Trust have expertise in the assessment, treatment and management of mental illness and severe mental health difficulties in women during the perinatal period. And you can find out more regarding their service at their website.